Nashubi, you may start.
I have chosen to be happy because it is good for my health. Rightly said by Voltaire. Good afternoon, ladies and gentlemen. Today, I, Navya Srivastava,
And I, Shubhi Gupta, students of Amity School of Languages, Semester 3, welcome you all to the event specially organized to celebrate Health Day. This event has been organized by Amity School of Languages in collaboration with Mission Pink Health, Community Health Project of Indian Medical Association.
in the wake of the pandemic, it has become essentially important for us to pay a good amount of attention on our health. Event organized by Amity School of Languages and Mission Pink Health on the occasion of Health Day 2021 aims at bringing together experts in the field of health so as to offer insights into the key areas of inquiry. The intensive session that has been planned includes talks by the speakers to educate the audience on the causes of anemia and how can we prevent it. The event aims at promoting awareness among the people, especially adolescents who are more prone to catch this disease.
Navya, let us make the audience aware about what Mission Pink Health actually is. So Mission Pink Health is a flagship nationwide committee health project of Indian Medical Association under aegis of Healthy Nation today and tomorrow. The Lucknow wing of MPH was established in January 2021. It is a comprehensive community. It is a comprehensive community health project to specifically address adolescent health needs. Main objectives of this project are: first, anemia control program; second, prevention of cervical cancer; third, prevention of child sexual abuse; and fourth, adolescent health.
The topic of today's discussion will be anemia in adolescents. Anemia is a critical public health problem in India that affects women and children throughout the life cycle. Anemia in boys and girls limits their development, learning ability, reduces concentration in daily tasks, increases their vulnerability to infection, increases school dropout rates, reduces physical fitness and work productivity. Anemia in girls during pregnancy is associated with premature births, low birth weight, and perinatal and maternal mortality. Adolescence is an opportune time for interventions to address anemia as it is an important time of growth and development. Missing out on nutrition education and IFA supplementation at this time may push young boys and girls further into the cycle of iron deficiency and anemia.
Any educational institute is elevated towards success under the guardianship of its head of institute. We are extremely grateful for our esteemed director, Professor Dr. Kumkum Ray, for her endless guidance and support. Today, unfortunately, ma'am couldn't be with us as she is engaged in a project. So we have our Professor Dr. Satyat Prakash, our interim head of institute, to wish us best for this event. Sir, I request you to address the audience and enlighten us with your words of wisdom. Over to you, sir.
Thank you, Shubhi. Thank you, Navya. First of all, on behalf of the director of the Amity School of Languages, Professor Dr. Kumkum Ray, and on behalf of the entire faculty of the Amity School of Languages, I welcome Dr. Rupali Srivastava and Dr. Akansha Sharma ji to Amity School of Languages and on this forum. So from the bottom of my heart, I welcome both of you, and I believe that the students, they would be benefiting from your presentations, and none other than celebrating the Health Day. You see, when I look up to my father and my grandfather and my forefathers, and when I ask them stories, there was a saying that early to bed and early to rise makes a man happy, wealthy, and wise. But now today what happens is we have changed it according to our convenience. Now it is late to bed and late to rise makes a man happy, wealthy, and wise. But is it really true? It sounds good, but then at the end of the day, what we are doing is it is affecting our health. The time which is meant for sleeping, we are keeping ourselves awake. Health is wealth. A sound body has a sound mind. So all these things, you see, I keep on telling that all the proverbs in English, they are actually a tissue of maxims giving you the eternity, immortality, and the universality of wisdom. It is for us. How do we take it? Early to bed and early to rise makes a man happy, wealthy, and wise is a saying not of today. It is coming through the ages. And in the world of technology, what we are losing is, you find it is affecting our health. So without taking much time, I would just like to listen to Dr. Rupali Srivastava ma'am, Dr. Akansha ma'am, and all my students of the Amity School of Languages. They are really eager because money is everything, but money is not the end of everything. So you can buy everything, but you cannot buy your health. That has to be polished, that has to be cultivated, that has to be practiced. Getting up in the morning, what should we do in order to keep ourselves healthy? Because I truly believe in the saying that early to bed and early to rise makes a man happy, wealthy, and wise is really an immortal, eternal, and universal saying, whether we follow it or whether we do not follow it. So with these words, over to you, Shubhi, and the forum is yours.
Thank you so much, sir. Your words have always proved to be a guiding light for all of us. And we'll definitely try to inculcate in us the habits and the qualities that you talked of, because definitely health cannot be bought. Shruti, our audience is keenly waiting for the event to move forward. So without any further ado, I would like to call on Miss Akansha Jha and Miss Ishita Shukla, students of BA English Honours Semester 3, to present a PowerPoint presentation giving us insights on the causes and prevention of anemia. Over to you, Akansha and Ishita.
A very happy good afternoon to everyone present in this meeting. Today, I am here to speak on the PowerPoint presentation regarding facts about anemia and the need for its awareness in today's society. Next slide, please. This is the table of contents which we will be discussing today. We will talk about September Nutrition Week, initial symptoms of anemia, groups at risk, serious symptoms of anemia, preventive measures that must be taken, and lastly, contact information. Next slide. Nutrition, National Nutrition Week. Nutrition contents in a person's body are very essential for proper functioning of the body and for avoiding deficiencies. And for this, a proper nutrition intake in our diet is also necessary. While various awareness activities are usually conducted to educate people on the need for nutrition in our bodies, National Nutrition Week is one such important event. The National Nutrition Week is celebrated from 1st September to 7th September. National Nutrition Week was introduced in March 1973 by members of American Dietetic Association to deliver a nutrition education message while promoting the profession of dietetics. In the 1980s, the initiative of National Nutrition Week gained much support, and this week-long festival expanded to a month-long observance. After this, the Government of India started the National Nutrition Week Commemoration in India in the year 1982. This campaign was initiated to spread awareness and encourage everyone to understand the importance of nutrition and adopt a healthy, sustainable lifestyle. Nutrition is the science of consuming and using foods. Food provides our body with energy, protein, essential fats, vitamins, and minerals to live, grow, and function properly. Therefore, a balanced diet is essential for good health and well-being. It is said that an unhealthy diet increases the risk of many diet-related diseases. The celebration of National Nutrition Week is based on a theme every year. And the theme for National Nutrition Week 2021 is Feeding Smart Right from Start, which focuses on consuming the right kind of food to keep yourself fit and healthy. So now, here is a video regarding the causes of anemia, which will help you all to give a better idea of it. Next slide, please. Anemia occurs when there are not enough healthy red blood cells to carry oxygen to your body's organs. As a result, it's common to feel cold and symptoms of tiredness or weakness. There are many types of anemia, but the most common type is iron deficiency anemia. You can begin to ease symptoms of anemia by adding iron to your diets. Now let's play the video. Should be next slide.
If you have anemia, your blood does not carry enough oxygen to the rest of your body. The most common cause of anemia is not having enough iron. Your body needs iron to make hemoglobin. Hemoglobin is an iron-rich protein that gives the red color to blood. It carries oxygen from the lungs to the rest of the body. It has three main causes: blood loss, lack of red blood cell production, and high rates of red blood cell destruction. Conditions that may lead to anemia include heavy periods, pregnancy, ulcers, colon polyps or colon cancer, inherited disorders, a diet that does not have enough iron, folic acid or vitamin B12, blood disorders such as sickle cell anemia and thalassemia, or cancer, aplastic anemia, a condition that can be inherited or acquired, and 6-PD deficiency, a metabolic disorder. Anemia can make you feel tired, cold, dizzy, and irritable. You may be short of breath or have a headache. Your doctor will diagnose anemia with a physical exam and blood tests. Treatment depends on the kind of anemia you have.
Next slide, please. I hope you all got a number of useful information from this video. We'll continue forward now. The initial symptoms of anemia includes dizziness, lightheadedness, fast or unusual heartbeat, headache. Next slide. Pain in your bones, chest, belly and joints, problems with growth, mainly from children and teens, shortness of breath, skin that's pale or yellowish, cold hands and feet, tiredness or weakness. Next slide. Groups at risk: children and senior citizens, individuals with health conditions or disabilities, pregnant and breastfeeding women. Next slide. Who is most likely to develop anemia? Anyone can develop anemia, although the following groups have a higher risk. Women. Blood loss during monthly periods and childbirth can lead to anemia. This is especially true if you have heavy periods or condition like fibroids. Children aging from 1 to 2. The body needs more iron during growth spurts. Infants. Infants may get less iron when they are weaned from breast milk or formula to solid food. Iron from solid food is not as easily taken up by the body. People over 65 years of age. People over 65 are most likely to have iron poor diets and certain chronic diseases. People on blood thinners. These medications include drugs like aspirin, clopidogrel, warfarin, heparin products, ifixaban, betrixaban, dabigatran, edoxaban, and rivaroxaban. Next slide, please. Now I would like to call upon Ishita Shukla to continue forward with the video. Thank you.
Thank you, Akansha. So, moving on to severe symptoms of anemia. Generally, signs and symptoms increase as anemia gets worse. Many of the signs and symptoms of anemia also occur in other diseases and conditions. Mild anemia may have no signs or symptoms. If you do develop signs and symptoms, you may have tiredness, weakness, or pale or yellowish skin. These signs and symptoms also occur in more severe anemia and are far more obvious. As anemia gets worse, you also may experience faintness or dizziness, increased thirst, sweating, weak and rapid pulse, or fast breathing. Next slide, please. Severe anemia may cause lower leg cramps during exercise, shortness of breath, neurological brain damage. A lack of RBCs also may cause heart-related symptoms because your heart has to work harder to carry oxygen-rich blood through your body. These symptoms include arrhythmias, which is abnormal heart rhythms, heart murmur, which is an extra or unusual sound heard during a heartbeat, and enlarged heart or even heart failure. Next slide, please. Moving on to the total number of cases of anemia worldwide as of July 2020. Globally, anemia affects 1.62 billion people, which corresponds to 24.8% of the population. The highest prevalence is in preschool age children, and the lowest prevalence is in men. Next slide, please. Anemia is widespread in India. 58.6% of children, 53.2% of non-pregnant women, and 50.4% of pregnant women were found to be anemic in 2016, as per the NFHS. India carries the highest burden of the disease, despite of having an anemia control program for 50 years. Next slide, please. Preventive measures to practice. Some kinds of anemia, such as those that are inherited, cannot be prevented. However, you can prevent anemia caused by iron deficiency, vitamin B12 deficiency, and vitamin B9 deficiency by eating well. This includes eating a diet with enough foods that provide iron and these vitamins, along with vitamin C food sources to help with the absorption. Make sure that you drink enough water because some studies have shown that this will help keep the hemoglobin levels up. Next up, we have a short video which would emphasize the significance of nutrition at every stage of life. May we have the video, please?
Nutrition is important at every stage of life. From the early years, optimal nutrition ensures children grow and thrive. School years are an important time to develop healthy habits. And these smart decisions should always be encouraged to ensure health and well-being for all, at all ages. Nutrition is particularly important at some stages of life, like during pregnancy. For enjoying a long, healthy life, it is a good practice to have regular checkups and eat healthy diets. Optimal nutrition is one of the greatest gifts you can give yourself and your loved ones.
With this video, we move on to the next topic, which is how one can manage anemia. While some types of anemia are short-term and mild, others can last throughout a lifetime. There are several ways to help manage anemia, including following a healthy diet, drinking enough water to stay hydrated, exercising regularly. However, if you have been weak, you should begin with exercising cautiously. Check with your healthcare provider about ways to exercise safely. Then we have avoiding exposure to chemicals that set off anemia, washing your hands often to avoid infection, taking good care of your teeth and going to the dentist regularly, talking to your doctor about any changes in symptoms, and keeping track of your symptoms by writing them down. Next slide, please. Remember these. You should eat iron-rich foods and foods that provide vitamins B12, B9, and C. This means that you can enjoy plenty of good food that is for you, whether you can eat meat or not. Citrus fruits, berries, and other vitamin C containing foods like peppers and tomatoes improve iron consumption. It is a good idea to get advice from your healthcare provider or perhaps from a registered dietitian about the best ways to eat when you have anemia. Some things have been shown to impair iron absorption. You should not take calcium and iron supplements at the same time. You may also want to avoid or limit these items, which are tannin containing items like coffee, tea, and some spices, milk, egg whites, fiber. You will not want to eliminate all fiber though, because taking iron supplements could cause constipation. And soy protein. May we have the next slide, please? Last but not the least, here are some helpline numbers where trained and compassionate medical specialists will be ready to answer your questions and provide the support you need. To contact the ambulance, you may dial 108 or 102, 1090 for the women helpline, and 1098 is the child helpline's number. Next slide, please. This brings us to the end of a presentation. I hope we were able to give some good insights and spread awareness about anemia. We need to remember that fitness is not a punishment, it's healing. Health is not a one-size-fits-all thing and may not be the same for everyone, but it is something worth fighting for. Thank you.
Thank you, Akansha and Ashita. It was truly a mind-boggling presentation, enriching us with causes and prevention of anemia. Now, the most awaited moment of the event arrives. We have our honorable guest speaker, Dr. Rupali Srivastava, with us here today. Ma'am is the founder and owner of Radius Joint Surgery Hospital, Gomti Nagar. She is MBBS and MS in Obstetrics and Gynecology from KGMC. She has been serving society, providing quality healthcare services through her hospital since many years. Her areas of interest are health protection, health promotion, awareness, and preventive care in adolescents. She has been actively collaborating with many organizations for the same. Ma'am, we are immensely delighted to have you here with us today. I would like to hand over the mic to you and request you to boost our mental horizon.
First of all, good afternoon to everyone. And thanks a lot for inviting me. I would like to thank Professor Dr. Kumkum Ray, who's not here today between us, but I would have really loved to have her here. And then Professor Dr. Satyarth Tripathi, Dr. Satain Mishra, and Assistant Professor Shraddha Srivastava. Thank you all for giving an opportunity to speak on this forum today. And last but not the least, I would like to thank all the students, because without the audience, the speaker has no value, right? So, and thank you to Navya and Shubhi for the wonderful anchoring. And Akanksha and Nishita, both of you gave such a wonderful, presentation on anemia, and such good knowledge on that. A lot of points were very good. And I would like to, move ahead from here to see how much I can add to your database, to your knowledge base. Okay. So, and I would welcome all the, faculty and office bearers of Mission Pink Health and all the members of Mission Pink Health. And I think Dr. Ruxana Khan now has joined between us. So, yes, good afternoon, ma'am. मैम आपको अनम्यूट कर लीजिए.
Very good afternoon. You all can hear me?
Yes, ma'am. I would request you to. She is our mentor and guide, and always encourages us in all our endeavors. She's the North Zone chairperson of Women Doctor Wing of IMA, and has always been there guiding us, encouraging us. So, ma'am, I would love to have a few words from you before I start anything.
My best wishes to all my Mission Pink group, Rupali, Akanksha, Nirja, and all a big group, and the more coming all beautiful girls. Surbhi, Akanksha, Navya, Ishita, and you anchored very well. Surbhi, all the best to you all girls. We are on a mission to have the whole nation pink. You all are looking beautiful, but we want to add your knowledge so you all will look more pink and more beautiful. So good going, Rupali and Akanksha, and as very rightly said, Rupali, without the audience, without you girls, and I hope and I wish that at least one girl, आप एक एक 10 को ये मैसेज पहुंचाएंगे. Alone we cannot, but together, yes, we can. So all the best to you all. Best wishes to you all. Okay, Rupali. Thank you, Akanksha. Rupali.
Thank you very much, ma'am. Now I would request Dr. Akanksha Sharma, who's Joint Secretary of Lucknow Mission Pink Health, and she's also an Assistant Professor of Psychiatry in RML Institute. So today Akanksha will tell us about what is anemia, its causes and diagnosis. So Akanksha, I invite you to please begin the session now.
Thank you, Dr. Rupali ma'am. I'm really honored to be on this platform, and I'm really thankful to IMA Mission Pink and my seniors because I'm a very, very junior to them. So, and thank you so much, the Amity University, the entire people and the entire managing team who have been really cordial since yesterday from our practicing to till now. So, without taking any further time, and y'all had an excellent presentation, and I really feel that I should be able to aid in your information. Akanksha, Navya, Ishita, and Shubhi. So, without any further ado, ma'am, may I have the permission to start? Rupali ma'am, I'll start.
Yeah, definitely.
Yeah,
Sure,
okay.
start.
So,
Akanksha, do you
if
have your
yes,
PPT? Should I share the PPT? What do you want
ma'am,
me to do?
ma'am, I have it open, but the
Okay.
screen share has to be done.
Okay, I'll do it. Yeah.
Yes, thank you, ma'am. So, we'll talk today about anemia in adolescence. It is actually a dialogue. So dialogue because it will be not a monologue, and we will be encouraging participation from the audience also. So let's starting with anemia. First of all, we should know what is anemia. Like technically speaking, definition of anemia is without the blood. That is very clear. That is a decrease in the RBC count, hemoglobin, and or hematocrit values resulting in the lower ability for the blood to carry oxygen to the body tissues. So here is given a very nice chart which explains that how anemia can affect the oxygen carrying capacity of the red blood cells and in turn can lead to various physical symptoms. Next. Coming to the prevalence of anemia worldwide, we all know we really should be very cautious now from onwards. We can look at the map given. We can very clearly see that the dark colored zones, which are unfortunately the Southeast Asian countries of India, Pakistan, Afghanistan, part of Bangladesh, and also a certain part of the Africa continent, we suffer from severe anemia, which is really now thoughtful to be thoughtful of. Next slide, please. Coming to the overview in India, let's talk about our country. Anemia is unfortunately a major killer in India. And to your surprise, the anemia prevalence is less in no age group. Coming from the children from 6 to 5 years, 6 months to 5 years, getting it into adolescent age group, where you should know that the adolescent girls, that is the age group of 15 to 19 years, has a higher prevalence than adolescent boys, which definitely we know has a lot of socio and cultural causes to contribute. Lactating women have a very high prevalence of anemia, and this is one of our target population. Pregnant women, both pregnant and lactating women have 50 and more than 50% of patients are anemic. Similarly, women of reproductive age are also, for example, you can take it like every 10 women in the reproductive age, 5 of them, that is a huge percentage, 50% are struggling with anemia. So, statistically speaking, that every second Indian, in fact, is anemic. 1 in every 5 maternal death is directly related to anemia, which is unfortunate for any country. Anemia affects both adults and children of both sexes. Although pregnant women and adolescent girls are more susceptible and most affected by the disease. Next. Let's see the degree of anemia. When do you call somebody anemic? So, for anemia, there is a classification guideline which differentiates that a male who is more than 15 years old has to have a hemoglobin level of 13 gram per deciliter to call him as normal and non-anemic. Similarly, when we talk about female, because of the menstrual cycle and because of an array of other parameters which are related to the hormonal changes of women, we have to know that female anemia is called when it is less than 12 gram per deciliter in non-pregnant and when it is less than 11 gram per deciliter in a pregnant woman. Severe anemia is when males have it less than 8 gram per deciliter and in pregnancy, women have it less than 7 gram per deciliter. Then it is called as severe anemia. Next, please. Coming to causes of anemia. Now let's get deep into it. Why? Why is there actually anemia in a developing country like India? Anemia, there are certain types and causes. So talking about types, there are varied types, as in 400 types of anemia. But to summarize, they are divided into three broad groups. Now, let's take it very simply. If you have less blood, we have to understand that what is the cause. Either we are losing it more, that means anemia caused by blood loss, or it is that because we are not able to produce it inside the body. It means that anemia caused by decrease or faulty red blood cell production. And third cause can be that we are producing it also adequately. We are not having a blood loss, but there is some factor which is causing the destruction of red blood cells inside our body. Hence, the third cause. Next slide, please. Causes of anemia. Now, coming to causes, as I have mentioned before, let's talk about the first cause, when anemia is being caused by blood loss. Now, we all know that we lose red blood cells through bleeding. And if it happens slowly over a long period of time, and you might not even notice, causes can include certain gastric conditions like ulcers. Some people have gastric ulcers, esophageal ulcers, hemorrhoids. That is, you people must have heard that, somebody has chronic constipation and is now passing blood also along with stools. That is called hemorrhoids. Gastritis. Gastritis is the inflammation of the stomach lining, which can happen because of chronic acidity. It can also lead to stomach ulcers and causes like cancer. Second comes worm infestations, which is very common due to the unhygienic hand hygiene practices prevalent in India. Also, certain drugs like NSAIDs, such as aspirin and ibuprofen. I have often encountered people, they take over-the-counter medications like aspirin, ibuprofen, whenever they have headache. And once we ask the frequency of taking such medications, to my surprise, it is often 3 times a week, 4 times a week, and it is going on since years and years together, which goes unnoticed and in fact can be a cause of anemia. Women, especially, that is a special category because women having heavy menstruation, which can be due to, as you had mentioned in your presentation, it can be due to fibroids or any other hormonal condition. If it goes unnoticed or if it goes untreated, then it also can cause anemia by blood loss. Post trauma and post surgery, if there is a heavy blood loss, then it can also be a cause. Next slide, please. Anemia caused by decrease or faulty red blood cell production. Now, there comes some other problems. If you are not having blood loss and still having anemia, you have to be worked upon and undergo some laboratory testing to know whether there is any problem with the RBC production. So, there are certain disorders which are of bone marrow because the red blood cells originate from our bone marrow. Bone marrow and stem cell problems like aplastic anemia, chronic lead poisoning, quite often seen in certain category of laborers who work in lead industry. Thalassemia, which is also a genetic blood condition. Iron deficiency anemia, sickle cell anemia, vitamin deficiency anemia, especially very commonly in our society is B12 and folate deficiency anemia. Anemia associated with other chronic diseases like hypothyroidism, kidney disease, cancer, rheumatoid, diabetes, and lupus like autoimmune conditions. Next slide, please. Now we have thought upon the first two causes. What about something going wrong inside our own body and that our RBCs are themselves getting destroyed? Why does it happen? When the RBCs are fragile and they can't handle the stress of traveling inside our body, they may actually burst, break, and that is called hemolytic anemia. That means that the heme inside the body is getting broken down. It can be due to various causes, and the most notorious is our immune system. In our immune system disorders like lupus, it can happen to anyone, even when there is inside the baby, inside the mother, there is a newborn baby, and there is also called hemolytic disease of the newborn. Conditions that can pass down through your genes, like as I have mentioned, certain blood disorders which are genetic. For example, sickle cell, thalassemia, and thrombocytopenic purpura. In some cases, there is also enlarged spleen, which is a rare case, but in fact can cause trapping of red blood cells and can destroy them too early. Something that puts strain on your body, such as any type of infection, chronic infections, drugs, any venom, snake or spider, and certain foods. Toxins from advanced liver or kidney disease can also cause RBCs to destroy. Certain vascular grafts, prosthetic heart walls, tumors, burn injury, being around certain chemicals, like I said, like for example, lead or heavy metals, severe hypertension, and other types of clotting disorders can also cause the RBC to die, burst, and get damaged prematurely inside our body. Next slide, please. Now, how do we know the diagnosis that we have anemia? So, for that, we have to know very important medical history taking, thorough examination of the individual, a physical examination, and complete blood count and other relevant blood tests. What to ask for in anemia? Now, feelings of tiredness and irritability are general symptoms. Palpitations, heartbeat fast and loud, dizziness. Sometimes the person can actually faint. Breathlessness, inability to concentrate, loss of appetite. Specific symptoms to rule out the cause: heavy periods, any chronic disease, any chronic medication history, history of pregnancy, and history of pica. Now, looking for the signs in anemia. How do we know? We have certain signs which a doctor can elicit easily in the clinic. Pale skin, pallor in the eyes, pale nails, tongue and lip pallor, damaged and dry brittle hair, brittle fingernails, and angular stomatitis. Now, coming to the investigations to diagnose anemia, the easiest being hemoglobin levels, by which we'll get to know what severity, what category of the person falls into anemia. Complete blood count, which will give a differential picture. Complete blood picture to see the shape, size, and color of RBC. Reticulocyte count, serum iron and ferritin levels, transferrin, and total iron binding capacity. Stool examination for occult blood and worms. Serum B12 and folic acid levels. Hemoglobin electrophoresis to see abnormal hemoglobin conditions, that is thalassemia, the type of thalassemia, and in some cases, even bone marrow biopsy would be required to diagnose aplastic anemia. This is a normal value of some different tests. Also, there are certain laboratory points of differentiation, how to differentiate iron deficiency anemia from thalassemia, from anemia of chronic diseases. So in iron deficiency anemia, first thing to know is the iron will be low, but the total iron binding capacity would be high, with ferritin levels being low. Contrary, in thalassemia, iron is sufficient and iron is in fact more, but the total iron binding capacity is less. In anemia of chronic disease, both the iron and the total iron binding capacity is low. Now, I would request Dr. Rupali ma'am to please enlighten us about the further prevention and treatment strategies for anemia. Rupali
Thank-
ma'am.
Yeah, thank you, Dr. Akanksha, for giving us this wonderful talk of how to diagnose anemia and the severity of it. So moving ahead from here, I would now like to tell you the prevention and the treatment of anemia. So one thing here I would like to say is, since this is anemia is so prevalent, like more than 50% of our population is anemic. So I would like to tell you that there is a government program that runs, that is Anemia Mukt Bharat. So why is this taken up? Because anemia एक preventive disease है, we can prevent it as well as treat it easily, especially the iron deficiency anemia. That is why we need to screen it and see and prevent and treat it. And for that, we do not always need a medical person. Our ANMs at the peripheral level, at the village level, they are all being trained under the Anemia Mukt Bharat scheme, and it is a wonderful project that is going on of Government of India. So, but that is a Government of India project, but we have to move parallelly in the private sector to again prevent and treat anemia, because this is causing a lot of damage to our society. I will tell you how. So we will majorly talk about iron deficiency anemia today. As Dr. Akanksha told you, there are more than 400 anemias. We cannot possibly take every anemia out here, but iron deficiency is the one that we can prevent and treat very easily and diagnose very easily. So following a few ways to prevent and treat iron deficiency anemia, I will take them up one by one. First would be dietary modifications, then what are the vitamin C rich foods, fortified foods and fortified salts, then medicine iron supplementation, and diagnose the other causes if the patient is not responding to the iron. Then treat the causes of increased blood loss like the worm infestation and increased menstrual loss. And a special category, that is our pregnant and lactating women, they have a very increased requirement of iron and calcium and everything. So we need to give them a special care. Now I'll take up one by one. Firstly, when I say that you have to take adequate iron, then you should know what is adequate, right? So for that we come to, this is a chart which tells you of different ages of males and females. But since we are talking of anemia in adolescent today, I would like to take up the category which you can see 14 to 18 years and then 19 to 30 years. There you see, from 14 to 18 years, the boys need 11 milligrams per day and girls need 15 milligrams per day. But from 19 to 30, which I think most of you would be there in this age group, the males require 8 milligram and the female require 18 milligrams. See the difference? It is almost double the amount that males requires. This is because they are now in their menstrual cycle phase and the loss is more, right? So, and also in our society, it may not be relevant for the urban areas, but in the rural areas, the girls are given less nutritive diet than the boys. So yeah, that is also a reason for more iron deficiency in the females there. So this is your, basically you remember that your iron requirement is 15 to 18 milligram per day. So this is your requirement. Now, how would you, reach this requirement? By having iron-rich foods. So what are iron-rich foods? Firstly, it is green leafy vegetables. I think all of you know that, because whenever there is anemia, your mothers or you must be making soups, having palak and all those kind of broccolis and lettuce and carrot and all those things mixed, and you take a soup for that, So green leafy vegetables are one. Then fruits and vegetables. Now in the fruits category, there is often a confusion that which fruit is rich, which fruit is not rich. So basically, when you cut a fruit and it turns brown when it comes in contact with the air, then possibly that fruit has iron. So apple, banana and potato, especially with the peel, is more, having much more iron, almost double. If you have potato with the peel, it's much better. So chukandar, anar and shakarkandi, and especially the prune, if you know prune juices, like plum juices, dried plum juices, that is very, very rich in iron. Okay. So cereal and millets, like you can always have these rajma, chole, chane, soya bean, and try to have these bajra, poha, dals, sprouts, quinoa, oats. All these are very rich in iron. And then dry fruits, especially the raisin and almonds are very rich in iron. then which I tell my rural population patients mostly is gur. They can always have gur and chana, which is their staple food as well. So this is a combination of jaggery and chana is a very good combination to have iron rich diet when the patient cannot afford. Then oil and seeds like kaddu seeds, sesame seeds, flax seeds, olives, they are all rich. And if you can get hold of blueberries, all kind of berries are iron rich. Then mushrooms and non-vegetarian foods there's meat and fish which is iron rich. And very important are the last 2 points, which I think you also emphasized, that take iron rich foods with lemon, oranges or any citrus fruits or citrus juice, because they help in the iron absorption from the gut. So it is very important to have iron rich foods along with citrus fruits. Then do not take tea or coffee or milk with iron rich foods. So this you have to always keep in mind. Then when you are having food, don't have these things along with them. Okay. Now I'm coming to Anemia Mukt Bharat. Again, this shows the percentages which you have also told, and I think Akanksha and Nishita have also told. And so here, moving forward from here, NFHS4 levels. If you see children from 6 to 59 months, the levels in 2016 were 58%. What we are aiming that by 2022, it should come down to 40%. Similarly, for adolescent boys, it should come down from 29 to 11 in 2022. Then adolescent girls, it should come down from 54% to 36%. In women of reproductive age, the target is 35%. Then in pregnant women, the target from 50% to 32%. Then lactating women, the target is 40%. So these are the targets by 2022. And there are 6 basically target groups, as you can see. So this is so important, and that is why there are many things which have been done to achieve this target. And so this I'm talking of the government thing, but parallel things have to be done in the private as well. So 6 interventions for prevention of anemia by Government of India, Anemia Mukt Bharat. The first is prophylactic iron and folic acid supplement. That is prophylactic. That means it is preventive. It is not when you have anemia, but when you are anticipating that you may have, it is just a prophylactic thing. Then second is a deworming. Third is intensified year-round behavior change communication campaign, including ensuring delayed cord clamping in the newborns. So this is what we are doing, the third point, intensified year-round behavior change communication campaign. So we are basically doing a communication campaign right today. So testing of anemia and point of care treatment. What does this mean? That means that they don't have to come to the urban area or to any lab. The testing of anemia is done at the point of care only. That is by different kind of hemoglobinometers. They test the anemia of the women and they start the treatment there and there by the ANMs itself. Then mandatory provision of iron and folic acid fortified foods in the government funded health programs, and then addressing the non-nutritional causes of anemia. In some endemic pockets, like we have malaria in different endemic pockets of India, especially UP, we have a lot of areas where malaria is endemic, and then certain fluorosis and hemoglobinopathies are endemic in certain areas. So we have to take a special reference to that. So first we come to the first step, and that is the intervention of prophylactic iron and folic acid tablets. Now, what does it mean? Here also you can see a whole chart where I have started telling you with the age group. I would like to focus here on the third one. School going adolescent girls and boys 10 to 19 years of age, and out of school adolescent girls 10 to 19 years. These are the beneficiaries of this Anemia Mukt Bharat. And then I would like to take the fourth one, which is women of reproductive age, which are non-pregnant, non-lactating, but 20 to 49 years. So here you see what does this say? It says weekly you have to take 1 iron and 1 folic acid tablet, each containing 60 milligram of elemental iron and 500 microgram of folic acid. I have written sugar coated blue color, pink color. You can see that is a government program. But what is for you? For you, you have to just remember that you have to take weekly 1 iron and folic acid tablet, and you have to make sure that it has 60 milligram elemental iron. When you will go to the market, on the counter, you will try to buy iron. you should look up the elemental iron content of that iron tablet. There are so many types of iron, iron sucrose, iron ascorbate, iron ferrous fumarate. Lot of type of iron compounds are available in the market with different kind of combinations, So, but what is important is that it should have 60 milligram of elemental iron and 500 microgram. If it is not there in the iron, there is another tablet available for folic acid. A Folvite tablet is available. You can have one tablet. So this is what is a preventive prophylactic iron, and this you girls can have. You can give it to your mothers as well. So this is the first step towards prevention of anemia. So now next I come to the next slide. Second prevention is deworming. We often know, but we don't practice this, that we deworming in our society, even if it is not confirmed by stool examinations or we don't diagnose it, still we empirically take this every 6 months. So this should be emphasized, okay? And the doses differ in the children below 5 years, but above that, it is all 6 monthly, 400 milligram, 1 tablet of albendazole, but taken by all. So all should take 6 monthly albendazole tablet, okay? So this will prevent your chronic loss, which you don't come to know, because worms, if they are present, they, eat up your epithelium of the gut, and there is chronic small losses of blood that keep on going in the stools, and it causes severe anemia. So this is a very important preventive step that you have to take. Deworming, albendazole tablets, 400 milligram, okay? And in pregnancy, it has to be taken care of that this is not given in the first 3 months of pregnancy. So it has to be given either when you are going to plan pregnancy or after 3 months if you have not given it before. So not in the first 3 months. So this is the second prevention. So I hope you girls can, remember this. So 60 milligram elemental iron, 500 microgram of folic acid, and 400 milligram of albendazole tablet 6 monthly, okay? Now we come to the third intervention of behavior change and communication campaign. This is a very important part because this is what we, the educated people, can do, We can always have a campaign where we can be aware of these things. So there is sufficient evidence that repeated engagement using consistent key messaging is required for any behavior to change or to initiate a new behavior so that it becomes a practice. The various behaviors change communication activities for this strategy will address 4 key behaviors. First is, again, I told you, iron folic acid. Second is appropriate infant young child feeding with emphasis on adequate and age appropriate complementary foods for children 6 months and above. Like Akanksha and Ishita, they said, feeding right from the start. This point says that only. So our population is not aware that when the weaning should be done, when and how the diet should be given to the children, and that is why there is high incidence of anemia in children below 5 years. So this is something which we need to talk on. Since this is a nutrition week, as you girls said, so we can at least try and read about weaning and tell other maids working in our houses, educate, as Dr. Ruxana ma'am said, at least 1% tells at least 10%, So this is how this communication campaign is going to work, right? So third is increased take of iron-rich foods, protein-rich food, and vitamin C-rich fruits through dietary diversification, quantity, frequency, and food fortification. Then, then promoting practice of delayed cord clamping by at least 3 minutes or until cord pulsations they cease in all health facility deliveries, followed by early initiation of breastfeeding within 1 hour of birth. So these are 4 key factors which need to be communicated at all levels. And how can you do that? Those various levels are various activities prepared for behavior change include sensitization meetings for the media, school teachers and administration, faith leaders, panchayat leaders, village health, sanitation and nutrition committees, etc. Then year-round broadcast of messages for Anemia Mukt Bharat. Then for community and school level communication, morning assemblies at school will be utilized to discuss nutrition and anemia. Youth festivals organized at school platforms will also be utilized to generate discussion and dialogue on anemia and nutrition. So here comes the role of you guys, very, very important role that you can play. So special press advertisements on occasions such as Nutrition Week, National Deworming Day, Women's Day, Breastfeeding Week, World Health Day, including engagement with celebrities, will be used to amplify the communication strategy. So making the community aware is a very important part which we educated people can do. So this is the third prevention method. Then we come to Fortified Foods was our first. Fourth communication was testing of anemia at point of care, I told you that. And then there are mandatory provisions by the government. जो midday meals इनके होते हैं ना, उसमें iron and folic acid have to be fortified. And we also can look up, we have many of the flour that we eat, the wheat flour, it can be fortified. So just look up the label when you buy some foods. Are they fortified with iron? We can have iron fortified salts and wheat flours and things like that. Okay. So now we come to treatment of anemia. Till now we were talking of prevention, where I talked of prophylactic iron and folic acid, albendazole tablets, and then communication campaigns and fortified foods. This is how, and iron-rich food. Now I come to treatment of anemia. Now, once you have anemia, that already Dr. Akanksha told you, how do you know you have anemia? Anything less than 12 is anemia in girls, and anything less than 13 milligrams is anemia in boys. So now once you have this documented, tested anemia, then what do you do? Treatment of anemia depends on the cause and the severity. Treatment and dosage will be different in children, adolescent, adult, pregnant, and lactating mothers. And today we will talk majorly about the treatment of iron deficiency anemia, and that too in adolescents. So firstly, if I come to mild and moderate anemia, which is mild is 8 to 11.9. So in this category, if your hemoglobin is 8 to 11.9 grams per deciliter, then you have to see that what you do. So here, 2 tablets of iron and folic acid daily, an hour after meals. Don't take it with your meals because you cannot be sure what you are eating, and then your iron absorption will be hampered. So containing 60 milligram elemental iron and 500 microgram of folic acid, this you have to take for 3 months. And don't take it with coffee, tea or milk. Try to take it with some citrus juice. नींबू का रस ले सकते हो आप किसी भी चीज के साथ. So it will be better absorbed. So what does it say? 2 tablets of iron and folic acid, each having 60 milligram of elemental iron. And this you have to take an hour after meal. Take this for 3 months. Repeat the hemoglobin after 3 months. And if it is improved, then continue the same treatment for another 3 months. And why is this done? Even if your hemoglobin and iron levels show they are normal, still you have to replenish the iron stores. Now what is iron stores? The body keeps, जैसे हम लोग एक stores में रखते हैं ना, iron body भी रखता है. It stores the iron in liver. लिवर में स्टोर करता है. तो अगर आपको एक्स्ट्रा 3 मंथ्स आप नहीं लेंगे, टोटल 6 मंथ्स नहीं करेंगे, तो ब्लड में तो हो जाएगा, लेकिन आयरन स्टोर्स आप अगर भरेंगे नहीं, तो जैसे ही आपका लॉस जरा सा बढ़ेगा, यू विल अगेन गो इनटू एनीमिया. So if after that hemoglobin comes to normal, that is 12 or more than 12 in girls, then continue with the prophylaxis. Prophylaxis meaning again go to the weekly 1 tablet of the same 60 milligram elemental iron and 500. So once your hemoglobin has reached 12 or above, then you again go back to the prophylactic doses. And if there is no improvement, then you have to be referred to the specialist. Till this time you can somehow manage it on your own. But if there is no improvement in hemoglobin after 6 months, then you are referred to the specialist. And keep in mind the supportive things like taking care of hygiene, nutrition. Also treat the underlying cause like the worm infestation, repeated diarrhea if you have, because there are many diseases like Crohn's disease and other diseases where repeated diarrhea occurs. And that also causes lack of absorption. And heavy menstrual bleeding, if that is there, you have to go to the gynecologist and treat that. So underlying causes have to be treated definitely, right? So regular checking of compliance of iron tablets, this has to be done by the ANMs or by parents at home. Well, I tell my students often that it is by parents at home. The parents check you, but I think the mothers in our houses, they neglect themselves totally, never caring for themselves. So here, you actually should be, complying to see whether they are having their iron tablets and rich diet or not. So it can be the other way around too, okay? So compliance has to be checked because often I see iron tablets are being purchased, but they are kept in the drawer, not being eaten. So they have to be eaten in order to get your iron levels normal, okay? Then we come to treatment of severe anemia, which is not in your scope, but just to mention it here. Any hemoglobin less than 8 grams per deciliter is severe anemia, and it cannot be treated at periphery, needs a specialist opinion. Treatment can be given orally with close monitoring or parenteral iron injections like iron sucrose or ferric carboxymaltose. These are injectable irons. Again, investigating and treating the underlying cause of severe anemia is very important, for which other investigations are required. I'm not going into the details of all this right now. Then there are certain things like treatment of vitamin B12 deficiency anemia. I'm just touching this anemia because this is also very common. In especially which kind of category this is common, although screening for this is not done, this comes as a second when after 6 months of iron, the anemia is not responding. Then you go in for serum B12 levels and folic acid levels and see if they are low. And they are and screening for this is done only in certain categories which I have mentioned: gastric surgery patients, inflammatory bowel disease, people who are on tab metformin, which is given for diabetes, and those having H2 blockers for acidity or ulcers for more than 12 months, and those who are on a strict vegetarian diet, because B12 vegetarian diet se nahi milta hai, and age of more than 75 years. So this is the category where you have to screen. Otherwise, B12 is mostly given in either empirically, or if after 6 months the the anemia is not improving after giving iron. So here you include diet having vitamin B12, and what you give is oral tablet 1 to 2 milligram or 1000 to 200 micrograms for at least 6 to 8 weeks, not before that. Or injections can be given alternate day for 10 doses. So this is in general, we can talk about pernicious anemia, which is another kind of B12 deficiency anemia, where even if you take B12, it is not being absorbed. There, one injection per month has to be given lifelong. So response of therapy is to be checked after 2 months by hemoglobin and by vitamin B12 levels. So just to give an idea of this, but these things are not done by your own. This has to be treated and diagnosed by the physician. So treatment of aplastic anemia is also like not in your scope, but just to mention that there can be a bone marrow transplant, repeated blood transfusions, and sometimes if this aplastic anemia occurs after chemotherapy and radiotherapy, then it improves gradually often. Okay, so this is just to give you an overview. This is management of thalassemia. I won't go into details of this, frequent blood transfusions and many types of thalassemias and why do they occur. What is relevant here is the next chart, which I will show you, because this is very important. Here, if you see the third and fourth category, where one parent is a carrier and where both parents are a carrier. This is the category which we need to diagnose. Why? Because the other first and second category, already one partner is having thalassemia. So they will definitely be aware कि भाई हमारे बच्चों को thalassemia तो नहीं हो जाएगा. So they will definitely go for testing. But the third and fourth categories are only carriers and there will be no symptom. They will not even know that they have thalassemia. This is the category where it is very important. And how do you know you are in this category? Nobody knows. So that is why we need to, when a person is going and planning for pregnancy, we need to, investigate for thalassemia minor or thalassemia trait, which we call. Why? Because if both the parents are a carrier, then there is 25% chance that one child will have thalassemia. And thalassemia, believe me, is a very bad disease to have. It is so much of economic burden on the family, lifelong, and the morbidity and mortality involved is too high. So there should be an investigation once you're planning to go ahead for a pregnancy. Thalassemia should be tested in both the partners. And this is what I just wanted to emphasize, So Baki remaining thalassemia is a very detailed topic. We can take up some other time if you guys want. Then I count what happens if we don't treat anemia. Kya hoga? So undiagnosed or untreated iron deficiency anemia may cause the following complications. It may cause depression. It may cause heart problems. If you do not have enough hemoglobin carrying red blood cells, your heart has to work harder, as you guys told me already, to move oxygen rich blood through your body. Cells and tissues need a steady supply of oxygen to work well. So when your heart has to work harder, this can lead to severe conditions like arrhythmias, heart murmur, or even heart failure. Then when you have anemia, there will be increased risk of infections. All kinds of infections are more when you have anemia. Then in the children, there can be motor or cognitive development delays. So this is very important. And you see there is a very high incidence in children of less than 5 years. So we really need to be focusing on those also, because the motor and cognitive development delay is there. Then pregnancy complications, many of them can occur, such as preterm delivery, giving birth to a very low birth weight baby. And in severe cases, the mother can have heart failure, shock, and even death. As I told you now, 1 in 5 deaths of mothers are due to anemia and related complications. Then post-delivery complications, such as higher risk of infections, there can be lactation problems, etc. Then in people with chronic conditions, iron deficiency anemia can make their condition worse or result in treatments not working as well. And it really affects your day-to-day work, your work capacity is hampered. All those things are also part of the complication of anemia, right? So these are the some complications in children: premature birth, low birth weight baby, heart failure, delayed development, developmental anomalies. These can happen in children. So these are certain references, and thank you.
Thank you so much, Dr. Rupali ma'am and Dr. Kansha ma'am. It was actually a very wonderful presentation, I must say, because whenever a question was popping inside my head, you both were just explaining it the very next minute.
Oh,
So it was
okay.
a wonderful presentation. I really got a lot of information from it.
Good.
Please carry on.
It was indeed an eye-opening and stupendous presentation, ma'am. And the knowledge that we got from this session, that will stay with us forever, and we will share this knowledge with others so that others can prevent anemia. Now, without wasting any time, I would like to declare the house open, and the audience would can start asking questions now.
You can raise your hands if you want to ask any questions.
I definitely have a question, ma'am.
Yeah, sure.
So my question is, ma'am, how do we detect anemia at home? Because often dizziness and weakness is associated with being tired. So how do we end this misconception?
Dr. Akanksha, since you told us about this, can you take up this?
Yeah. So I think, would like to know that how can anybody diagnose in general, right? Like once we have like
Yes.
maids we have coming and they are always tired and they are sluggish. Most commonly, people present with sluggishness, slow motor activity. And if you tell them something, they'll walk for a few steps and they'll be like breathless. So these are some signs and some symptoms. So as I said, signs can be like you can always examine the lower palpebral conjunctiva. Like you can look into it. Like grossly, you can check the hands. Like what I do in general is I ask them to show their hands in broad daylight, and they will have like we have a little bit of pinkish tinge, and the people who are anemic, they'll be like pale yellow. There will be no pinkish tinge. We can check anemia by the lips, tongue. You can ask the person to protrude out the tongue. You can check it from the palpebral conjunctiva. You can just lower it down and you can see yours in the mirror. It will be pinkish or reddish also. But people who have anemia, they will also have a very, if they have anemia or malnutrition in general. Anemia never comes alone. It often comes with malnutrition. So you will have a bad quality of skin. Even hair would be, frizzy or brittle nails. So these kinds of, these are easy signs and symptoms which you can just, walk in and walk out detect anemia, like screen anemia. Okay. And then obviously, if somebody is very pale, a child you see, is very pale, yellowish, and then you can definitely order laboratory test. And it's a very simple, very, cost effective test, hemoglobin and a complete blood count, which is very, very diagnostic test, I must say, for a lot of issues, including anemia. You can actually screen, you can actually see the blood indices and can even detect that which type of anemia we are going into. Okay.
Yeah.
So
Yeah.
it's easily available and we can do it walk in, walk out.
Yeah.
Thank you, ma'am. Thank you so much. Is there anyone else who wants to ask a question?
Yes, Anushka, you can continue. You can ask.
Okay, good afternoon, everyone. So, ma'am, talking about heavy menstruation or heavy blood loss, ma'am, if this takes place once or twice, then do we have to go to the doctor or is it like natural?
No, once or twice is okay, but if it is a regular feature, only then you need to show it to the doctor. Okay?
Okay, ma'am. Thank you.
Yeah.
Ma'am, one question from my side also.
Yeah, sure.
Ma'am, if the blood loss is continuing for a few more days, like regular days, is it like for like 10 days or 9 days like that? So in that case also, do we have to go to the doctors if that has happens only once?
Only once never matters. What we always see is what has been your pattern. If it has been 5 or 6 days, or it has been 8 days, for maybe for somebody 8 days is a normal. So if it is the once in a while occurrence for anything is not important, you don't need to go, right? You have to see and record your menstrual pattern. Okay? And I think you guys are very smart. You must be having different kind of menstrual apps to do that. So yeah, so okay.
Okay, ma'am. Ilma, please, you can ask your question.
Thank you so much, Shruti. Thank you so much, ma'am. So my question was, ma'am, please share your views about anemia being a fatal disease, because in India usually people take any disease or a test serious when they know that it is fatal.
No, any severe anemia can be fatal. Mild and moderate anemias cannot be fatal, but so much of morbidity is attached with it. You don't feel like working, you don't feel like studying, there is loss of appetite, which further leads to further malnutrition, so you don't want to lead this kind of unfit life. So if you take that, one thing, fatality means something जिससे कि you will encounter death. So it's the mild and moderate parts are not fatal, but yes, severe one is fatal. And I told you the incidence already, that 1 in 5 mothers, they die of severe anemia in pregnancy. So this is a big number. It needs to be addressed.
Yes, thank you so much.
Ma'am, Ishita, yes, Ishita, you can ask.
Ma'am, at one point you mentioned that there are motor or cognitive development delays in children. So would
Yeah.
you please elaborate on that? Like, what are those development delays?
See, there are different milestones at different ages that happen, no? At 3 weeks, there would be head holding. At 4 to 5 months, a child will sit. At 9 to 10, it'll walk, that way. So these are development milestones, these are motor milestones. And then cognitive is, you would be knowing better what is cognitive, different type of activities where the mind is involved. So when your mind is sluggish, your body is sluggish. So all these development process, the milestones are not reached, at the appropriate time. Okay.
I can see two more. Yeah, Miss Millie, you can go. Go ahead.
Thank you, Shubhi. Ma'am, first of all, though, I just want to say that the way you covered everything, the session was very informative and it was very good. I have one question that, as you mentioned about deworming and 6 interventions for preventions of anemia by Government of India. So please, can you tell about this in simple words, if possible?
In simple words.
Yes, ma'am.
Like what is simple words? There are 6 interventions. First is that you have to take iron and folic acid tablets. Second is you have to take deworming tablets. Third is that you have to communicate. All those who can communicate to the people who are not so well aware, communicate to them. Have fortified foods, if possible. Okay. So these are the interventions.
Okay, ma'am. Okay, ma'am.
Jagriti?
Yes. Good afternoon, ma'am. Ma'am, first of all, most of my questions got already answered by your presentation. I just had a small doubt. There was a word mentioned, angular stomatitis. Can you please elaborate a bit more?
Yeah, angular stomatitis is something when you notice sometimes there is at the angle of your lips, here at the angle, there is some kind of, ulcer or some kind of erosion which is painful. So that is angular stomatitis, which often occurs in vitamin B12 deficiencies, but can occur in iron deficiency as well. That is angular stomatitis. Okay.
We
Okay,
also
ma'am.
have
Thank you, ma'am.
Satyam, sir. He wants to ask a question, sir. You may go ahead.
Yeah, please.
Thank you, Navya. And before I ask a question, I would like to thank you, Rupali ma'am and Akansha ma'am, You really have a knack of explaining things which we rarely find in doctors in the world of today.
Thank
So
you.
it was so very well explained by both of you that as one of my students was saying that she wanted to ask many questions, but by the time she wanted to ask the questions, they were already answered. So that is really a knack which each and everyone doesn't have. It is
Thank you so
only
much.
with few people, and I'm really thankful to Shraddha that she brought you on this forum. And Shraddha, we need many more sessions from both the ma'ams.
Yes, sir. Sure,
Shraddha?
sir.
Sure.
Yes, sir. Sure.
Sure. Most
And
welcome.
now, ma'am, it's our pleasure and privilege for our students as well as for our faculty to listen to you to those subtle nuances which people actually don't even think of them.
Yeah.
And by preventing, they can save their health.
Definitely.
No
That is
need
the
for
whole
even
purpose.
taking medicine. Yeah, that's true. Ma'am, now my one question is that children these days, they have molded the proverbs according to their living, according to their late to bed and late to rise makes a man healthy, wealthy, and wise. I want from you a piece of advice that this, it should be changed. Because nowadays I am seeing that children, even my son is also doing this. I keep on telling him, better don't do it, but he has developed, and I think many of us, we sleep at 2 a.m. in the morning and then get up at 10 a.m. next day. I think our health, you see, those days when our great grandfathers and our fathers, they used to say, beta, early to bed and early to rise makes a man happy, wealthy, and wise. I think they were more than 100% true in that saying. But today, what happens is that we have just changed. So, ma'am, from your side, what is your take on this? Ma'am, you are mute, ma'am.
I'm saying this is a very nice question and a very sensitive one too. Sensitive in the sense all the younger generation thinks it otherwise, and it is we people who think still in the older proverb, right? But and I keep telling my children, as you said, your son follows, mine too. My children also do the same thing. Although I keep telling them that the body has a circadian rhythm, which is philosophic, physiologically there. एट अराउंड 3 to 4 जब हम लोग कहते हैं ना ये पहला प्रहर क्या बोलते हैं प्रहर बोलते हैं ना पहला जब प्रभात होती है 3-4 बजे उस समय पे हम लोगों के जो हार्मोन्स की एक सर्ज होती है दैट इज कॉल्ड द सर्केडियन रिदम and it is actually good because it enhances your learning and your retaining capacity, your memory, everything is enhanced at that time. And it has not been found till date, even if children get up at 10 or whatever, the circadian rhythm doesn't change, so still it is there. And I wish that children understand this and go around like this, but it's a more of a wishful thinking, I think. Akanksha, would you like to tell us something about this? Since you are in psychiatry, maybe you can help us.
I will genuinely agree to you, sir. This has been a problem, and I would say these are budding nuances, like the hazards of social media. I'm sure we can sit some another day and speak about it. Like I can endlessly speak about it. So yes, early to bed and early to rise, it is very important. Like I encounter this when I see patients of insomnia. They are like, we sleep by 12 or 1, and it's okay, it's cool. And I tell them that it's not cool because see, electricity we invented. Ideally, we are supposed to sleep by a biological rhythm when the sun is going off. Okay, that is how we were destined to sleep biologically. Now we have modified till 10, 11. Okay, there is a going bed time, and we have developed too much. Like we are developing each day. So then came social media, then came Netflix and the entire OTT platform. And I think now the sleeping time has gone from 10, 11 to 2, 3. And there are certain kids who sleep like 4 a.m. in the morning, and the parents have a headache because of them. And definitely it is affecting the biological rhythm is very important for your brain neurotransmitters to function properly. Yeah, it is very, very important, and it can lead to certain mental health issues which we are all seeing. So I think yes, early to bed and early to rise. And I have also seen various, there are certain programs available, and there are paid programs. How waking up in Brahma Muhurat will give you a successful life. And I was really surprised to see such programs on the Facebook. It's like, ये तो हमारी पुरानी बातें हैं. See, now they are charging and telling us the same thing. So smart of people.
We say
Yeah,
that.
so
Thank you,
I
ma'am.
agree.
Yeah. Meditation at the Brahm Muhurat at 4 or 5 is considered to be
Yeah.
really, really good.
Seriously, even studies, like when I was a student, I was told by my parents कि जो पढ़ना है ना, जो याद रखना है बहुत अच्छे से, वो सुबह सुबह उठ के पढ़ने का. I have practiced it. Like I would wake up at Brahma Muhurat, मतलब 4 सवा 4 हो गया, मतलब Brahma Muhurat हो गया, and I would wake up and study my biology and physics especially. I have done.
Nice.
Thank you, ma'am. Over to you, Navya.
Thank you so
Thank you,
much,
sir.
both of you. And thank you, sir. It was lovely hearing you both, and really it was very informative. And it has widened our insights about health and anemia. Your words will definitely guide our way in future. Now that we have come towards the end of the event, I would like to invite the extremely enthusiastic batchmate of mine, Ms. Vanshika Mason, to deliver the vote of thanks. Vanshika, over to you.
Thank you so much, Shruti. A warm and a grateful afternoon to our most valued, distinguished Professor, Dr. Satyat Prakash Tripathi, Honorable Chief Guest, Dr. Rupali Srivastav, and Dr. Akansha Sharma, and also Ruxana Khan ma'am, our management committee, worthy professors, my dear friends, and everyone gathered here. It's an honor to have been asked to offer the vote of thanks. I bow my head in veneration to the Almighty for showering His benedictions on all of us. I must remark a proficient sense of gratefulness to our distinguished director, Dr. Kumkum Ray, for taking the initiate for being the convener of this great event. I would express my heartfelt gratitude to our respected professor, Dr. Satyat Prakash Tripathi, for addressing the audience of the event on behalf of our distinguished director, Dr. Kumkum Ray ma'am. On behalf of Amity School of Languages and the entire management of the group present here, I express my heartfelt gratitude to Dr. Rupali Srivastav ma'am and Dr. Akansha Sharma for sharing her knowledge in abundance with us. And ma'am, we look forward to work with you both as well. I want to extend my generous thanks to our faculty coordinator, Dr. Satendra Kumar Mishra and Ms. Shraddha Srivastav for their wholehearted support to all the students. I would also like to thank our student coordinators, Ms. Shubhi Gupta and Ms. Navya Srivastav for being such a great support in this event. I also want to thank the wonderful presenters of the day, Ms. Akansha Jha and Ms. Ishita Shukla for presenting their insightful presentation. And also, I would like to thank all the members of the ASL department and the faculty members of the other institute for gracing this event. I'm very thankful to all the members and the staff who coordinated to work with this event. With this, we come to the end of the meeting. Thank you so much everyone for joining today. Nowadays, the situation in our country is nerve-wracking. So please stay home, stay safe, and stay healthy. Have a nice day ahead. Thank you so much.
Thank you.
So much. Thank you all.
Thank you.
I would request that my faculty members who have joined from the campus that we are Satendra sir, if you can hear me, please let me take the
I don't think he's able to hear.
I don't know, something went wrong
I
with
clicked
my
the screen
laptop
share.
camera in the morning. That's why I was keeping myself off. But let me see if we can.
Okay, I have taken the screenshots. Thank you so much everyone for joining, and thank you so much.
Thank you.
Thank you so much, all of you. No. I'm going to end up the recording.